My name is WinklerPrins, and I'm a family physician and a family medicine educator. Right now, I actually work as the Vice President for Student Health, the Assistant Vice President for Student Health officially at Georgetown University, where I'm responsible basically as the Public Health Officer for the university and overseeing all the health services. It's not a traditional family medicine role. It's very unique, but I'm the only physician at the table for most of the discussions here at the university. And so as a family medicine doctor and as an educator, I think I have a unique position to really shape sort of the discussions and how people respond to health-related events on campus. And I think having both a background as a physician and as an educator, I think are incredibly valuable in those spaces. So something to look for, that kind of job too, for all you out there. So I was born to my father, who was a GP from the Netherlands in a tiny fishing village on the southern coast of Newfoundland. And I lived there for 5 years until I moved to the United States. And I went to medical school at the University of Michigan, a 6-year combined pre-med-med program. And while I was there, I liked all of it in terms of my medical educational experiences, but I did not like the setting in which I was learning. I was pretty miserable my first couple of years of medical school. Wasn't really sure why, and it took me years to figure out why, and that was largely because when I was getting disconnected facts in my first couple of years of medical school, none of that stuck. None of it stuck. It was only until I really had the opportunity to really start taking care of patients that I could really contextualize a lot of that information and hang it on the tree of the person that I was responsible for. And I think after finishing up my medical degree, I then went into private practice in small-town Wisconsin, where I was for almost a decade, with some time spent working in Brazil and some time spent working in the Netherlands. But all during that time that I was working, I really felt that at some point I was going to go back to medical education, in part because some of my experiences in the learning environments that I've been part of was so challenging for me, and I really wanted to see if I could do it differently for other people. I think I also had some learning difficulties early on that weren't really addressed. I think it was mostly about how I learned, and that was so different from others, as I sort of mentioned earlier. And I think I wanted to make sure that I was in spaces where I could address some of the deficits that I saw in my own learning that I think were not being addressed. And so those two informed my decisions to be an educator.